The spike in RSV cases paired with the impending rise in flu and COVID infections, leading state and local health leaders to urge caution.
I have to believe that we all care about children. I have to believe that we care about the well-being of all of our healthcare workers. And I want people to know to keep your kids close this holiday.
And by close, Dr. Jennifer Vines and Dr. Ann Loeffler with the Multnomah County Health Department mean reconsider plans to gather and keep very young, vulnerable kids at home.
Consider the possibility of calling that host and saying, you know what, I think we have to delay this. We may need to schedule our Thanksgiving for February. And if you're a host and you're getting that phone call, I would just suggest that you be very gracious.
Children's hospitals in Portland and beyond going into crisis mode, pushed to the limit and filling up to capacity with RSV cases. That includes Dornbecker, Randall Children's, and now Providence St. Vincent.
So in order to create more room, they're doing things like delaying procedures that can wait. And they're also getting creative with staffing, which is understood to mean that staff are asked to care for more than the usual number of patients that they might be asked to care for.
Young children less than 6 months of age are at the highest risk. But right now, about a third of the hospitalizations are in the 6 month to 3 year age. And again, corresponding to the possibility that these slightly older infants and toddlers haven't had RSV the last couple of years.
If you have to be around others, consider wearing a mask and refraining close contact with vulnerable kids.
Now we know that COVID and flu are both transmitted in air, for kind of a 6 feet distance. But we've always known for 50 years that RSV is transmitted more on surfaces.
These local health experts say most kids will not be sick enough to visit the ER, and they're hoping this advice will help families keep them as healthy as possible.
Keeping the kiddos' nose clean, using some salt water and some sort of nasal aspirator, using some Tylenol if by bringing a fever down, it makes the kiddos feel well enough that they can drink enough to stay hydrated.
RSV is nothing new. It's common and it usually pops up around this time every year. However, the past 2 years have been unusual. Kids under 3 that would normally get a minor case didn't until now. That's why doctors believe they're seeing this surge. We've got an article up now with more about the symptoms and what to do on KGW.com. Brittany?